Liz.
All right, good afternoon, everybody. My name is Sarah Ingersoll. I'm the campaign director for Text4baby at the National Healthy Mothers, Healthy Babies Coalition. And before I introduce our first speaker, I just want to thank and acknowledge all of the folks that pulled together this exciting briefing today. First, I want to thank you so much to the staff at Senator Carper's office, Ayode's office, Senator Cochran's office, and Senator Landry's office. They worked together with us to pull together this briefing across party lines with short time frames and lots of different perspectives and ideas in a tremendous way. And I'm really honored to have had an opportunity to work with everyone. Look forward to our continued work together. I also want to thank very much the American College of Obstetricians and Gynecologists, one of our core partners for the Text4baby program, and a partner in supporting this congressional briefing today. Now I want to introduce to you Senator Tom Carper, senior senator from Delaware. Senator Carper started his service in 2001. Prior to becoming Delaware's senior senator, Senator Carper served as Delaware's state treasurer, U.S. House of Representatives for 5 terms, and as governor of Delaware, serving 2 terms. Before entering Delaware politics, Senator Carper attended Ohio University on a Navy ROTC scholarship, graduating with a BA in economics. And as you'll hear, this theme of economics is an ongoing and important concern of his and why he's part of the Text4baby program today. He completed 5 years of service in the U.S. Navy as a naval flight officer and continued to serve in the Naval Reserve until retiring from military service in 1991 with a rank of captain. From his position on the Senate Finance Committee, Senator Carper authored or co-authored a number of initiatives to rein in the growth of healthcare costs while improving outcomes. Among those provisions that were included in the comprehensive healthcare reform laws were measures to improve America's access to primary care and preventive care. Senator Carper's been an advocate for Text4baby since Delaware became involved in the program last year, and his support has lent recognition to Text4baby in Delaware, helping it win last year's National State Enrollment Contest. As a proponent of finding ways to get better health outcomes for less money, Senator Carper recognizes the potential of Text4baby program to disseminate critical health information to underserved communities, increase access to prenatal care, and encourage healthy behaviors. During his tenure as governor, Senator Carper took several steps to combat infant mortality, including creating Delaware's perinatal board to further understand causes of premature births and increase access to prenatal care. The senator vows to continue to support efforts to make pregnancy safer for mothers and children, and we're very, very honored to have him here to speak with us today. Thank you, Senator.
Sarah, thank you. Test. Does this work? Yes. Thank you very, very much. Thank you all for being here today. To those in front and on our panel, we especially thank you for organizing us. Thank Olivia, who I call O, and Lynn Shaw, and others on my staff for their help on this too. When I was a congressman running for the job of governor in Delaware, I remember being at dinner. I think the former governor was there, Pete DuPont was there, and some others were there. And I was asked at that dinner about, if you become governor, you can have anything you wanted, what would you want? What would you ask for? And I said, I would ask for a magic wand. And I asked for a magic wand, and what I want to do with it is to use this to make sure that every child born in this country was born to 2 loving, caring, nurturing parents who were engaged in their child, had high expectations for the child, understood their obligation to prepare their child for success. That's what I want. Became governor. I looked around later that day after I was inaugurated for that magic wand. Didn't find it. But what I found was a really good idea. The idea that I found out about was the idea of creating a Family Services Cabinet Council in our state. And we took half the cabinet secretaries in our administration. Secretary of Health and Social Services, Secretary of the Kids Department, Secretary of the Labor Department, Secretary of Corrections in our state, Economic Development, Public Safety, everything that touched on families. Everything that touched on families. And we decided that we were going to give it the stovepipes and just to work as a team, to do everything we could think of to strengthen families. Starting from the time kids were ever born, when kids were given birth to kids, statewide campaign on teenage pregnancy, trying to make sure that when people roll out of the hospital, show up in the hospital to give birth to a baby, even before that, we enlarge and increase the amount of care that people are eligible for, that the program we're eligible for through Medicaid. We want to make sure healthy babies were born. We came up with the idea of something called Growing Together Portfolio. This is the Cliff Notes, if you will, of trying to get your child ready for success. It's like a thing of a 5-year calendar. And every week or every month, turn over a page and see what you're supposed to be doing with your child at age 1 month, 2 months, 3 months, all the way up to 5 years, the immunization schedule, helpful tips for who to contact and have questions about this thing. We took a program, a Missouri program called Parents is Teaching to the statewide. And we said every month we want a parent trainer to be in a home to say to the parent or parents, where's your Growing Together portfolio? Let's get it out, let's make sure you use it. And we have books with this for the children and everything. We had some extra money, state government at the time. We took some of that money and made it possible. Every 4-year-old in our state in poverty would be in a Head Start program. Half of them were not funded. We used state money to do that. We took money for kids who were like 3 years of age. And older brothers and sisters had gone on and just have a miserable experience in school. Their parents weren't involved in their life, and some of these parents weren't present in their life. And we went to work on those 3-year-olds to make sure that by the time they were 4-year-old, they were in a Head Start program, full-day kindergarten, and then we just tracked them in longitudinal studies. And you know what? Those kids ended up doing remarkably well. They did as well as the kids from intact 2-parent families. And but a big part of it was this Growing Together portfolio. This is an analog tool, and it's an analog tool in a digital world. And Text4baby is a digital tool in a digital world. And we have the ability now not just to hand out the Growing Together portfolios, and these were copied by a couple dozen states. The idea was copied and shared, I think, fairly broadly, very proud of that. But Text4baby is a much better idea. So we don't have to rely on somebody, keeping us on the refrigerator and going and checking the refrigerator every day or every week and making sure that folks are doing the right thing for the kids. Just about everybody has a text, has a phone. Most people know how to text. Even old senators know how to text. Of course, when it's a little son, we have to do that stuff if they want to. And so this is an idea that works. And one of the things that I'll close with, and Sarah mentioned in her introduction, we had this huge budget deficits. Got to figure out how to get them under control. And it means we have to find ways to do everything we do. To ask the question, how do we get a better result for less money or a better result for the same money? I don't care if it's defense, I don't care if it's housing, I don't care if it's agriculture, transportation, education, everything. We got to figure out how to get a better result for less money or the same amount of money. This is a great tool for the digital world. And it works. And it works. And as a recovering governor, I'm really interested in what works. And this is something that works. We were proud in Delaware to have done pretty well in the friendly competition last year. We want to see a whole lot more competition because the good thing that comes from that competition is a whole lot more kids that will be born healthy, that will grow up healthy, and will be able to, when they walk into kindergarten at the age of 5, they'll be ready to roll, they'll be ready to be successful. And they will know from experience that the kids that are ready to roll and be successful at age 5 in kindergarten. It's a lot less likely that they will be disrupted in school, that they'll miss school, that they'll drop out of school, to be a burden to the rest of us for the rest of our lives. So I applaud everybody who came up with this idea, and I'll end it with this. Have you ever heard the old saying, if a tree falls in the forest and there's nobody there to hear it, it's a really noise? Yeah. Could it be a great tool like Text4baby, and there's nobody to hear about it, and nobody knows to use it? Is a really great tool to help a whole lot of kids, and well, maybe not. We're here to make sure that when that tree falls in the forest, there's big noise, and people react to that noise and do good things because. Thank you so much.